Good morning, Nelly. So I'm just checking to see if my audio is clear.
Morning, Kashifa. Yes, it's clear. I can hear you.
Thank you. I'm going to just turn on my video as well.
Okay.
All good? Can you see?
Yeah, I
Okay.
can see you. Yeah.
Okay, thank you.
All right, bye.
Recording in progress.
Good morning, honorable members. I'm sure all of us have managed to log in, except for one person who was saying is having a challenge. That is Honorable Shabangu. I am going to switch off my video. I'm using my phone. Is everybody in the meeting?
Morning, Chair.
Morning, morning, morning.
Morning, Chair.
Morning, thank you. We are then going to start. I'm going to switch off my video. I just wanted you to see me that I'm appropriate for the meeting. The weather at Gqeberha is quite challenging. My yard is flooded by somebody's pool that has overflown to my space. So we are just in that situation, but the weather is not right here in Gqeberha. Otherwise, thank you very much, honorable members. We are going to, before we start, I want to propose an approach to the meeting so that we are all in the same page. A process that says, first, let me apologize for the report that we all received yesterday. I'll apologize on behalf of the committee section, the content advisor in particular. And then because of that is why I want to put this to the committee for consideration, that we will receive a briefing from the content advisor, but more focusing on recommendations, on observations and recommendations. And then after that, we will then ask clarities. And then after clarities have been addressed, we will then adjourn so that we give each members a time to really go through, see where to amend, see where to add. And then I'll try to apply to get a space for us to then, before the 25th, which I think it will be Thursday after plenary, because in the morning it's caucuses. Thursday after plenary, we then adopt our report. We'll then have the discussions and then adopt the report, because I don't think it will be fair for me to want this to be presented today and then we adopt them today when we have only received the report yesterday. I just want to put that to members. If we can just address that just for a few minutes and then allow the content advisor to take us through. I will then hand over to you members, check if there are any comments.
Chair.
Or Honorable van der Merwe.
Chair, no, I think your proposal is sound. If we can get the presentation, and then of course we can then interact with the committee staff if we want to make any further proposals after the presentation, and then come back to adopt the report. I think that is a sensible approach, and we support you in that, Chairperson. Thank you.
Thank you, Honorable van der Merwe. Any seconder to that? Are members in the meeting? Or is it codes?
Chairperson,
Hello?
I'm sorry. I was struggling to raise my hand. Chairperson, I was like to ask,
Honorable Kanyile.
yes, can I come in?
Yes.
Okay, thank you very much. Good morning to you. Good morning to the colleagues as well. I was later covered by Van der Merwe. I'm also in support, Chairperson.
Thank you, Honorable Kanyile. Honorable Space, your hand is up.
No, Chairperson, it's fine. I concur.
Thank you. There is nobody who is against that. In the light that there's no other members that are against that, I will then request Ms. Abrams to take us through mainly on what basically the introduction, and then go to observations and recommendations. I'm raising that because the other body is what the department have presented. Over to you, Ms. Abrams.
Good morning, Chairperson and members and colleagues. Thank you so much. I'd like to extend my apologies. I worked extensively on this report. Our report is very long, but it's very comprehensive. We've ensured that we've covered everything. And this morning, as chairs indicated, we will focus on the introduction and take members through the observations and recommendations. And then with Chairperson's approval and the members, there are two particular items I'd like the researchers just to give and shed more light on for members. I think it would be important in terms of the context of this BRR. So Crystal, if it's fine with Chair, will talk to matters pertaining to the CGE in relation to commissioners, that audit finding that's outstanding regarding part-time commissioners and payment, as well as just general expenditure of the CGE. And then Tasneem would talk specifically to matters related to the NYDA in terms of the expenditure. So I'll go through the obs and recommendations, and with Chairpersons, if that's fine, if they can just talk specifically to those two items. Thank you. I'm going to turn off my video and then share the document. Neliswa, if you can just give me co-hosting rights, please, then I'm able to share the document. Thank you.
Done, Kashifa.
Yeah, thank you, Neliswa. Is the font big enough, Chairperson? Are you able to see the document?
No, not yet.
Neliswa, is the document shared? Can you see it?
No, not yet.
Whilst you are still struggling with, okay.
Okay. Thank you, Chair. Is the font big enough? Is that fine? Is it clearly legible?
It is. Can you just increase it a little bit? If you can. I think that's fine for me.
Okay. Thank you, Chairperson. So today we have our draft budgetary review and recommendations report for the Portfolio Committee on Women, Youth and Persons with Disabilities, and dated the 22nd of October. Once the committee has adopted, we will take out the word draft, and it would just be the budgetary review and recommendations report, our BRR. The Portfolio Committee, having considered the annual and financial statements of the department on the 8th, and then we had the CGE and the National Youth Development Agency on the 15th of October, reports as follows. The introduction outlines to members and the person reading the report what the intention of the report is, that for the 7th Parliament, it's our first BRR. We're looking specifically at having examined the annual report for the department, the Commission for Gender Equality and the NYDA. We've reviewed those reports and we've met those particular entities on the dates cited previously. We've also engaged with the Auditor General of South Africa and the respective audit and risk committees. This was particularly important, one, Firstly, to get an understanding of what the audit opinion is by the AG, and in terms of the ARCs, which are internal to each of these entities, to gain a perspective from them throughout the year of what their concerns, challenges, and also recommendations were, and then to see whether there was synergy between what the auditor found and recommended and what the ARCs have found and recommended. As Chair's indicated, I will now move straight to observations and recommendations, but just briefly give members a sense of what this report entails. Number 2 just goes over the strategic overview. It gives you an outline of the purpose and mandate for who we overseeing, which is the department, the CGE, as well as the NYDA. The next sections of the report gives you an understanding of why it's been put together, why we've considered the Q1, because the BRR in essence gives you a reflection of the previous financial year under review, which is 23-24, as well as Q1 for not 23-20, it is for 24-25.
Sorry,
Yes, Chair.
sorry to disturb you. I made a serious mistake. I didn't ask for attendance.
Apologies, yes.
And I see people here that I don't know. For instance, read.aa meeting notes. I don't know who is that one. I don't know who is Kanyan Tsulumbana. I don't know who is that one. There are people that I don't know here. My apologies. Nerissa, can you just quickly take us through the attendance register? I don't know who's Glovedale. Please, can you please take us through the attendance register?
Oh, thank
Sorry
you,
for
Chair.
that. Members,
Good
sorry for that. My sincere apologies.
Good morning, Chair. Good morning, and members and my colleagues. Chairperson, we have Honorable Adams, Honorable Spies, Honorable Peterson, Dr. Klape, Honorable Kasa, Honorable Van der Merwe, Honorable Kanyile, Honorable yourself, Tunjwa, Honorable Khoekana, Mabel Khoekana, Honorable Shabangu, and Honorable Adonis. And we also have the support staff, which is myself, Nelly Swawi, and Mvaba, Kashifa, Tasnim, Crystal. And we have support staff from the department chair. I saw, just hold on. Oh, we also have Mr. Shombe, who is an interpreter in isiZulu, from Parliament. Kayan Tsulumba, I'm not sure where he's from, but he'll have to introduce himself. We have Ms. Dubulekwele Nompelo from the ANC support staff. Smusi Sokoza is from the department, particularly the Office of the Deputy Minister. And Ms. Thandi Mpondo, she's also from the department, from the Office of the Minister. She's the PLO. We have Ms. Seeley from your office, Chair. Thank you, Chair.
No, thank you very much. Can who's Tim Matthews? Can he or she introduce himself?
It's Tasneem, Chair, the researcher.
Oh, sorry, Tasneem. Sorry. And read a meeting notes. Who is that one?
Chair, I think that's just an automated thing that comes with a Zoom meeting. It takes notes for the meeting. It's not a person.
Sure. So Zoom is taking our meeting, our notes. Yo, you didn't introduce Jasmine, Honorable Peterson.
It's Honorable Peterson. I mentioned, Chair.
Okay. No, you are telling me something that I haven't. I'll have to inquire about this. What does this mean? Who's Cliffdale?
Hi, Chair.
It's Crystal.
Just 11, the other researcher.
Okay. Okay. Thank you. Thank you very much. You can continue, Ms. Abrams. Sorry for that.
No problem.
Yeah.
Thank you, Chairperson.
Okay.
Can I just for our minutes, Chair, can we just verify from Nalisa, was there any apologies tendered, just for the record? Thank you.
Thank you, Chair. Through you, there were no apologies submitted
Okay.
to me. Thank you, Chair.
Thank you,
Thank
Chair, just
you.
so that we can accurately reflect in our minutes as well.
Okay.
Thank you. Yes, Chair?
No. Continue.
Okay, so again, just which is described in this paragraph. The rest of the document then, as Chair has indicated, takes members through everything that the department, the NYDA and the CGE has presented to the committee, as well as the AG and ARC. So now I will move straight on to the observations and recommendations. This is essentially the most important component of our BRR. It reflects what the assessment is from the committee in relation to the engagements with the entities for the dates of the 15th and 18th of October. I'm just going to find the page for the observations and recommendations. If you can just be with me one moment. Thank you. Just do that. Okay, so number 15, the committee's observations. It's taken into consideration as the committee had interacted with the department, the AG, NYDA, the CGE, and they are as follows. We've reflected the observations and the recommendations in terms of structure, starting with the department, then looking at the CGE and then NYDA. So in terms of general recommendations, I must thank both the researchers and the involvement of Neliswa, because we capture the observations based on what members have engaged with and what was said, as well as key issues that have emanated from the analysis. So the committee commends the department, the NYDA and the CGE for tabling the annual reports within the specific time. The committee commended the department for receiving a clean audit for the 2023-24 financial year. It observed that the annual report reflects 36 out of 41 targets met, which is an overall 87.8% achievement. A performance was noted from, I just need to correct this, sorry. My apologies. So the annual performance was noticed from 95% in the previous year to 2021-22 to 81% in 2019-20, which was noted with concern. And what is basically indicated here is that when you look at the department's current performance of achievement, from where the department had come to where it's been. So previously it was very low in 21-22, which is 81%, and it's improved in the current financial year. In terms of what the committee observed for the total appropriation, as per vote 20, which was just over 1 billion, which included the transfers of over 733 million to the NYDA and 95.1 million to the CGE, which takes that total transfers to 828.4 million. The committee observed that the department's overall budget was reduced by the 42.5 million, resulting in an adjusted total appropriation of 993.9 million, following the medium-term budget policy statement and the adjusted estimates of national expenditure. And members would recall Crystal had gone through in terms of the money that was in based on the initial E&E and why there was reductions in relation to both the department, NYDA and CGE. The committee observed that the department was left with an actual operating budget of 208.605 million to complete its undertakings and activities for 2023-24. The committee noted that the department spent 99.625 million, which is 98.5% for 2023-24, which including the transfers to the CGE and NYDA. It spent 95%, which is just over 198 million of the budget, which is the operating budget of 208.605 million, with a surplus under expenditure of 10.319 million. Specifically, it's an under expenditure. Let me just correct that. The underspending increased the previous financial year from 8.455 million. The committee observed that the department constantly raises concerns about being underfunded, however, continues to underspend. The recurrence of underspending is concerning. Again, we're just reiterating, one, the department indicates to members they need more money, they're underfunded, but similarly, they're also having this under expenditure. And it hasn't just been for this financial year, but it's been for the previous financial year as well. The committee observed that the majority of the targets met in Programme 1 relates to compliance matters in terms of the development and submission of reports. However, it remains a concern that it continuously consumed the largest proportion, which is about 56% of the department's operational budget and staff complement. So overall, Programme 1 takes the bulk of the money of the operating budget. The committee noted with concern the department's continued reliance on consultants, despite having highly paid personnel employed that are expected to deliver on targets within the core programs by the department, then also maintains it has inadequate funding. And several members have raised this as a matter of concern, not only during the engagement of the annual report, but as well as our previous meetings when we looked at the APP. The committee concurred with all the findings and recommendations of the AG and the ARC in particular. The committee concurred with the AG that the department should ensure greater emphasis is placed on improving the lived experiences of women, youth and persons with disability through the delivery of its targets as outlined in the APP. The committee observed that the department had made great strides to implement the AG recommendations and those of the ARC. Specifically in terms of LGBTQIA+, the committee was concerned that the department was silent on matters in this regard within the annual report, and then just generally in terms of their briefing to the committee. With respect to the committee's, the department's mandate, the committee questioned the extent to which the department was giving effect to the mandate for in the 2023-24 financial year, and how this related to improving the lived experiences of women, youth and persons with disabilities. The committee questioned whether the targets achieved made a difference within communities. The committee questioned how the department had contributed toward eliminating poverty and reducing inequality and unemployment, with a particular focus on women, youth and persons with disabilities, specifically for the financial year 23-24. To this end, the committee inquired about the key achievement linked targets that demonstrate the department was able to lead socio-economic transformation and implementation of the empowerment and participation. Sorry, it's not participant. Of women, youth and persons with disabilities for 2023-24. The committee related this back to the view expressed by the AG regarding the need the target needing to translate to improving the lived experiences of women, youth and persons with disabilities. So in essence, the concern expressed by the committee about its mandate is, are they delivering on their mandate when you don't see visible change in terms of lived experiences of women, youth and persons with disabilities? In terms of the institutional impacts and outcomes, in the annual report, this is in a table and outlines what the impacts and outcomes were, the department. The committee observed that the department reflects on what it intends doing per outcome for the 2024-25 financial year and simultaneously providing a brief synopsis of progress to date by prefacing it with, at the time of this reporting period, when unpacking the institutional impacts and outcomes in the annual report for 2023-24. Hence, it's unclear in terms of what was achieved for the year under review as for 2023-24, as this was not delineated under each impact and outcome. Furthermore, the narratives provided are generic and the linkages with the outcome are not always evident. For example, the outcome improved skills for women and youth and persons with disabilities. The department's response was the implementation of the Sanitary Dignity Implementation Framework by provinces allows the beneficiaries to attend school without interruption, as learners were sometimes unable to attend school due to a lack of access to sanitary pads. This wasn't substantiated with evidence to support exactly how many girls and girls with disabilities benefited from receiving sanitary pads and what statistics there was to support the improvement in school attendance by the cohort. Moreover, the impact relates to improved skills by the Sanitary Dignity Program is limited to indigent girls as beneficiaries of sanitary product and does not relate to women and youth. So it's unclear how the department made the link with the skills acquired have not been identified. So in essence, coming back to, it's great that the department has given in the annual report institutional impacts and outcomes, but what we cannot see is, because they reflect on what they intend doing, they also indicate at the time of this reporting period. So it leaves the reader and members unclear about, well, what was the impact and what was the outcome? And in the instance of the sanitary dignity, they don't specifically say, well, we reached so many goals in this financial year. So that makes the reading of the annual report quite difficult. In terms of the main services which the department outlines in the annual report, the committee noted, as with the reporting on progress in relation to the institutional impacts and outcomes, the progress noted in terms of the actual achievement in relation to the main service reflects on the year under review at times, and in other instances merely stipulates the achievement. So, for example, research report on practices on poverty alleviation across BRICS countries developed. Because there's no time period linked, it is unclear whether this was achieved in the year under review or prior to that. So again, when a member reads the annual report and they see, wow, the department has developed its research report, your assumption may be maybe they did it for this financial year, but because there's no date, one cannot assume that it may have been done in the previous financial year or before that. Moreover, there appears to be inconsistencies in reporting. For example, the actual achievement noted was the IKH, which is the Integrated Knowledge Hub, available on the department intranet in relation to the main service. Establish a knowledge gateway for women, youth and persons with disabilities, socio-economic transformation and equality. However, the narrative provided, specifically in the annual report under Program 3, page 76, indicates that there was no, that this was not live, the Integrated Knowledge Hub, because of a lack of progress on the IT development phase at the department's IT challenges related to the website and budgetary constraint. So here again, it shows the inconsistencies. They talk to the IKH being available on the intranet, but when you look at Program 3 in terms of targets, here they're saying that target wasn't delivered because of the problem with IT and the budget constraints. Furthermore, the actual achievement reflected on 83 indicates that the target was not achieved and the hub was not accessible for usage. This points to a lack of cohesiveness in the annual report. In terms of strategic priorities, the committee noted that the department reflected on what progress it has made considering the goals outlined in its strategic plan under the institutional impacts and outcomes, as well as main service, even though it may not have expressly stated so. In terms of policy imperatives, the committee acknowledges the importance of assessing the performance of government insofar as the various goals and targets related to women, youth, and persons with disability related to the NDP, MTSF, SDG 5, and Agenda 2063. Its concern. The committee noted that the department only referred to one instance where progress was made in relation to the MTSF target for the preferential procurement of allocation for women-owned businesses in public procurement. But even in that instance, no specific details are provided. Moreover, the committee noted that fleeting reference is made to the MTSF and NDP in the annual report, but only in relation to its link to a particular target. So, for example, the disability rights tool that was developed is in accordance with the NDP. The committee observed that there was what was not evident in the department's annual report was a comprehensive account of what progress has been made in relation to the aforementioned goals. So in other words, when it comes to the MTSF, SDGs and SDP, it's important for the committee to have a sense of, for the year that we are assessing, what has the department identified in terms of how far government has gone in reaching those goals that specifically talk to women, youth, and persons with disabilities. They don't talk to that in their annual report. Visibility of the department. The committee remains concerned about the general awareness of the department's mandate and its visibility within communities, despite the department having indicated that it implemented a communication strategy to provide the public with timely, accurate, and clear information about department policies, programs, plans, services, and initiatives in a non-partisan way, thus making it accountable to the public. So even though the department is saying there's this strategy and that's the purpose, the concern from members is based on your experience, based on your work within constituencies, there's generally a lack of awareness of this department's mandate and its visibility within communities. Looking at policy and law reform, the committee observed that the National Gender Policy Framework was reviewed, which is welcomed, but notes it did not receive the updated policy, nor has it been briefed on the changes. So this policy is very key for the country in terms of that overarching guide when it comes to gender mainstreaming. We haven't received that updated policy. If members if you have to Google now, this extremely old, probably more than 10 years. The committee observed that the Disability Rights Bill is long overdue and has been in development for the entire 6th administration, which is concerning. The committee observed that the progress made regarding the South African Youth Development Bill, but that it's still not been tabled. We now look at specific performance-related matters for the department coming to Program 1. In terms of the overview, the committee observed that in Program 1, it achieved 7 out of 8 targets, which is 87.5%, and spent 93.2% of its budget. This program continued to have the largest staff cohort, 73 posts filled with 14 posts additional to the establishment and 6 vacancies. In terms of human resource, for concurrence, the committee requested more information on the concurrence to appointment in terms of the DPSA Circular 49 of 2023. The committee queried whether the department was allowed to appoint staff without concurrence as provided in the DPSA Circular 49 of 2023. The committee's concern was that appointments were either still delayed because of the outstanding concurrence or positions filled, yet concurrence was still outstanding. The inconsistency was noted. With respect to skilled personnel versus lack of capacity, the committee observed that of the 136 filled posts for the financial year 2023-24, 44 are in senior management, 44 was in the highly skilled and production, 40 in the highly skilled supervision category. As such, 80 employees within the department are meant to have the requisite skills to function at a high level, given the employment ranking, to be able to give effect to the department's mandate and achieve the goals it has set out. However, the department maintains that it has a lack of capacity and is reliant on consultant, yet continues to underspend on compensation of employees by not filling vacancies. Furthermore, the committee observed there were no promotions during the period under review, but 76 employees received notch progressions within a salary level. That's 56% of the total staff complement. These pay progressions were paid to staff members in the salary levels 3 to 5. There were 7 employees. Levels 6 to 8, there were 23 employees. Levels 9 to 12, 18. And 28 in senior management level, which is 13 to 6. The committee also inquired whether support staff from other government departments can be seconded to the department to deal with the capacity issues. In terms of the SMS cost, the committee observes that for the year under review, senior management constituted 49.8%, 63.174 million of the personnel cost, and the highly skilled supervision level, which is the 9 to 12, it makes up 30.5% at a cost of 30.684 million. So again, this reiterates the department is very top heavy. It has many senior, highly skilled people for which a considerable amount is being paid for in terms of cost of employment. With respect to gender parity, the committee observed that despite the predominantly large female workforce, which is 88 of 136 employees, which is about 65%, the majority of women, which is 33, are in clerical positions, 25 fall in the professional positions, and 22 fall within legislatures, senior officials, and managers category. Furthermore, the majority of males employed in the department fall within, which is 19, fall within that category, legislatures, senior officials, and managers, followed by 15 in the occupying professional positions. With respect to use of consultants, the committee noted with concern the department's continued reliance on consultants to deliver on targets within the core programs, despite numerous calls from the committee to desist from doing this. The committee acknowledges that the number of consultants and cost incurred for consultants have decreased from the previous financial year. So in other words, they're using less consultants, but they're still using them. But it brings into question how the department was addressing the lack of capacity and budget, but continued utilization of consultants to do evaluations and research to produce reports, yet had within its employee highly skilled and paid staff. So the issue here is they're using consultants, but as we described before, they do have many highly skilled personnel being quite a bit to deliver on some of these targets within the core program. Hence, the committee sought more clarity about the difference between consultants utilized and the department's internal monitoring and evaluation unit personnel tasked with delivering on those deliverables. Furthermore, the committee observes that 16 consultants worked on projects related to the National Strategic Plan on GBVF, amounting to 10.4 million in donor funds, which is a sizable amount. In terms of employment of persons with disabilities, the committee commended the department's progress in the employment of persons with disabilities and exceeding the employment equity target in this regard. However, the committee sought more information about the array of persons with disabilities employed. As the committee noted, it should not be confined to examples with visual impairments. Members would have noted within the responses to your questions, they gave an outline of the 7 employees with disabilities and the type of disabilities each employee has, which is not all visual. The committee queried why the department was aiming to fill 82% of vacancies and not fill all vacancies given the capacity constraints. The committee questioned why the department wanted to create more posts when there were vacancies that are existing in the department. With respect to vacancies, the department observed a vacancy rate of 6.8%. It observed that notes 16 out of the 18 additional posts that were identified have been unfunded due to implications of an unfunded 2023 wage agreement. The committee remains concerned about the implication of the posts that are now unfunded and the effect on operations within the department. Furthermore, the committee noted that the department had not identified any critical positions that need to be monitored as of 31 March 2024, which is concerning given the concerns raised by the ARC and the AG in terms of critical vacancies. In terms of DC cases, disciplinary cases, the committee noted there were 4 disciplinary hearings lodged and all were resolved. In addition, the department recorded 1 case of misconduct related to gross negligence and insubordination. With respect to the financial performance, the committee notes that the department's financial performance for 2023-24 has been commendable, but notes the underspending in Q1 of 2024-25. The committee noted with concern the number of deviations incurred, employment of contract workers, and use of consultants, given the budget constraints to implement its mandate. To this end, the committee requested clarity on these issues to them to lobby for more funding from National Treasury. In other words, the committee made it very clear, in order for the committee to lobby for more money, you need to have an understanding why are they still having consultants and why so many deviations. In terms of audit findings, the committee sought more clarity about the 2 audit findings that were not implemented by the end of 23-24. The committee acknowledged that written responses were sent to unanswered questions on the annual report briefing, but it did not include information about this outstanding audit findings. I've been through the responses. It doesn't indicate more information about those 2 matters. Under expenditure, the committee noted with concern the 10.319 million under expenditure for a department with a small operating budget, claiming it is unfunded. Furthermore, having assessed the department's Q1 performance for 24-25, while slight improvement was noted, the continued under expenditure in certain programs is of particular concern. In terms of rollover funds, the committee notes the department's request to National Treasury for a total 30 million in rollover funds, which includes 5 million requests by the CGE. The committee commends the department for not incurring any irregular expenditure and unauthorized expenditure for the year under review. The committee notes the historical irregular expenditure incurred awaits condonation from National Treasury. The committee notes that the department incurred fruitless and wasteful expenditure of 37,000 during 2023-24, which was due to interest raised by the government employee pension fund as at 30 September 2023. The cases were referred to the internal audit unit for the determination of facts. A report was tabled to the accounting officer and consequent management was implemented. That's 2 officials involved received warning letters. Whilst the committee welcomed the mitigation action, and notes that it was an isolated case due to the changes in the processing of the GEPF payments for the banking system from National Treasury. The department indicated that all payments thereafter were paid on time through the new payment system, which the committee welcomed. As members can see, where progress and efforts were made, this is acknowledged in terms of your observations. The committee observed that the department did not occur any unauthorized expenditure 2023-24, which is commendable. The unauthorized expenditure for the four financial years, 32.774, also awaits feedback from Scopa through National Treasury. With respect to vitamins, the committee observed vitamins totaling over 9 million, of which more than 8 million were shifted to Program 1 for goods, services and transfers and subsidies coming from Program 2 and 4, the core programs. In addition, Program 3 received 543,000 from Program 2, while Program 4 received 513,000 from Program 3. So between programs, there was a shift in money. Focusing on deviations, the committee noted with concern the consistent pattern of deviations by the department year on year. It observed 15 deviations, less than the 37 from the previous financial year. However, the deviations still amounted to over 3 million, which is less than the previous year, where there was 23.39 million. So of the 15 deviations for the 23-24 financial year, 9 were single source appointments and 6 related to obtaining less than 3 quotes, amounts more than 2,000 Rand. The committee noted with concern that none of the department's deviations were recorded and only 2 of its contract variations or expansions were reflected in the Q1 report, having assessed the OCPO reports for all 4 quarters of 23-24. In addition, the contract variations recorded were not those reflected in the annual report. In terms of contingent liabilities, the committee noted the outcome of the court order instructing the department to pay 101,000 to Barloworld South Africa. In addition, the committee also noted with concern 2 claims of 7 million against the department related to the case, which is T. Mzenzi versus department, which is a long-standing matter dating back many years, which is concerning. I think, if I recall, it's probably coming as far back as the 5th administration. That's how long this matter has been unresolved. The committee urges the department to keep it abreast of developments in this regard. In terms of donor funding, the committee observed the sizable amount of donor funding received from the European Union and the CARA fund primarily for GBV-related activities. The committee notes that the assessment of donor funding and how it was utilized is imperative, given that it was directly linked to the delivery of targets within the core programs. In addition, the committee notes that such funding has implications on the operational budget, which is evident in the department's Q1 report, whereby Program 2 underspent because they used CARA funds instead. So it's important for the committee to have a better understanding of all this donor funding coming to the department, how it's being spent, and on what. In terms of investigations and consequence management, the committee commends the department for improvements in implementing consequence management and urges the department to resolve any ongoing or outstanding investigations and to keep the committee abreast of developments in this regard. With regards to supply chain management, the large number of deviations are a cause of concern and points to poor planning and can be avoided. In terms of ICT, the committee noted with concern the ARC's finding that inadequate human and financial resources remained a challenge that prevents the ICT unit to function at a level that adequately supports the department to achieve its programs. Now, focusing on the AG and the ARC's findings and recommendations specifically for the department. The committee concurred with the findings and recommendations of the AG. In terms of consequence management, the committee noted improvement of consequent management as identified by the AG and ARC. With respect to scope of audit, the committee welcomes the audit of Program 2, 3, and 4 of the department. In terms of outcomes of performance audit, based on the AG's audit of the entities in the portfolio, the committee acknowledged the AG's opinions expressed regarding the impact of the department, NYDA and CGE, considering the targets achieved and budget spent for the year under review. The committee emphasized the importance of the AG's recommendation that the clean audit of the department must be translated into improving the lived experiences of the citizenry, namely women, youth, and persons with disabilities. Similarly, whilst the NYDA achieved all its targets, which was commended by the AG, this achievement still needs to be translated into improving the lived experience of youth in the country, which the committee also concurred with. The committee was concerned that the department has not been able to obtain the necessary information from governments or gain their cooperation to assess the implementation framework regarding the procurement spent on women-owned enterprises. Yet, the committee noted that through the work of the AG, it was able to track the implementation of the framework by 4 coordinating departments. Through this work, the AG identified that the Department of Public Works developed a strategy to guide the implementation of gender issues via the gender responsive planning, budgeting, evaluation, and auditing framework in the sector. The committee commended this action and indicated that Public Work, which is DPWI, compared to other departments, had made significant policy strides and could be viewed as best practice. Hence, the committee indicated that this best practice should be examined further in order to replicate what was learned with other departments. So for donor funding, specifically in relation to the AG, the committee observed the lack of information from the AG regarding donor funding received by the department, NYDA, CG, and expenditure in this regard. Whilst the committee acknowledged that the donor fund includes international and private donors, there is also cadre fund that has been allocated to the department. Donor funding contributes to the delivery of programs, and such the funds should be accounted for. The committee indicated that an assessment of donor funding was important, given that it will link to almost all of the core programs. Moreover, donor funding has implications on the operations and budget allocated. This was evident again in the report of the department for Q1, in which underspending was recorded in program 2 as cadre funds were utilized. With respect to the adjusted APP, the committee observed that the AG made no reference to the department's repeated adjustments to its APP in the last quarter of the financial year. In this case, it was 2023-24, and this appeared to be a pattern for the past several years, which is concerning. In terms of the ARC, the committee acknowledges the findings and recommendations of the ARC, that it concurs with that of the AG. And in terms of deviations, the committee questioned whether it was acceptable for the department to have so many deviations within a financial year for the ARC not to have expressed an opinion in this regard. The committee maintained it was not satisfied with so many deviations in the year under review, given the department's small budget, and that this appeared to be a pattern that had persisted in Q1 of the following financial year. In terms of internal control, the committee notes the ARC's reports, which indicated that the system of internal controls for reporting the period was adequate and generally effective, which is commendable. Furthermore, the committee also notes the concern expressed by the ARC regarding resource constraints for the internal audit function to work optimally, and if not urgently addressed, had the potential to adversely affect the system of internal controls within the department. In terms of the internal audit, the committee notes the repeat finding of the ARC regarding limited human resource capacity of the internal audit unit, and that it should be addressed as a matter of priority. The committee noted that the ARC acknowledged the efforts made by management to capacitate the internal audit function, which was severely undercapacitated, but remain concerned with the human resource capacity challenges in internal audit, and this impacts negatively on the function's ability to perform its responsibilities as expected, consequently to provide adequate assurance to management and the audit and the risk committee. In terms of risk management, the committee notes the repeat finding by ARC that risk management was under-resourced, and this could adversely affect management's ability to adequately manage fraud risks and the implementation of ethics management processes. In terms of in-year monitoring quarterly reports, the committee notes the ARC's satisfaction with the quality of the monthly and quarterly reports. In terms of the annual financial statement, the committee notes the ARC commended management on improving financial performance reporting, which in turn resulted in an unqualified audit opinion with no material findings in this regard. For compliance with legislation, the committee notes the ARC's observation that the department's clean audit was attributed to the sustained implementation of internal controls in financial reporting and an improvement in compliance with the laws and regulations. With respect to ICT, the committee notes the ARC's concern regarding inadequate human and financial resources within the department, that it remained a challenge that prevents the ICT unit to function at a level that adequately supports the department to achieve its programs, and in turn compromises security, segregation of duties, and business service continuity. In terms of consequence management, the committee noted improvement of consequence management implemented to address irregular expenditure, which was commended by the ARC. And then finally, for the audit action plan, the committee concurs with the ARC recommendation that the accounting officer develops an audit action plan to resolve the audit findings identified during the 2023-24 financial year. Furthermore, the committee noted concern that the the audit action plan and risk mitigation actions were not fully implemented by the department. And that's the two outstanding audit findings for which the committee requested more clarity and information, which we never received. The next section in terms of the observations looks now at your core programs, which is programs 2, 3, and 4. Some general and commentary and overview. The committee commends the department for achieving the 29 out of 33 targets in its core programs during the year under review. The key concern noted by the committee was the under-expenditure, which was incurred mainly due to vacancies. In terms of policy and law reform, the committee commends the department for finalizing and for tabling the NYDA Amendment Bill and the National Council on BFL. However, the committee notes concern that the department has yet to introduce bills it has proposed, such as the Wedge Bill, the South African Youth Development Bill, and the Disability Bill. With respect to reports, the committee acknowledges the report submitted as evidence of the work achieved for the year under review, but notes some are still outstanding. So members would recall about a month ago, they had sent some of the documents for members to consider, which included some of these reports, which they said are now were targets achieved. Furthermore, the committee has repeatedly urged the department to submit reports within 1 month of finalization to the committee for consideration. Oversight is weakened when the committee is not privy to products yielded by the department as evidence of targets met. The committee also notes that not all reports are available on the department's website and as such not accessible to the public. So when the department says target achieved, it produces a report, we go onto the department's website to actually check to see is that report available. And what the observation is there, that some of these reports that they produce is there, but not everything. So if it's not available to the public and is not available to the committee, how are people expected to access these reports? For program 2, the committee commends the department for achieving all 9 targets in this program as per the annual report 2023-24. In terms of interventions to support economic empowerment and participation, the committee notes that the department had identified number of interventions to support economic participation and ownership for women, youth, and persons with disabilities per year. In its initial APP 2023-24, as one of its key indicators, which is linked to the NTSF2, economic transformation and job creation. The committee commends the department for achieving this target. However, the committee questioned the extent to which these interventions facilitated economic and job creation for women across the country and its impact on the whole. So again, what we are focusing on here is we note that a target achieved and it's meant to link to a broader NTSF priority, but the committee's questioning, is there really evidence to show that there was economic transformation and job creation for women across the country through the achievement of that particular target, which is 4 interventions. There was also a target related to interventions to support social empowerment and participation. The committee commends the department for achieving the target, but notes that several of the interventions reported on appear to be once-off initiatives with no clear indication of upscaling or replicating nationally. Given the department's limited resources, human and financial, as well as requisite skill base, it is unclear how and why the department undertakes activities where the Department of Health and Basic Education is currently leading with skilled personnel to do, for example, sex education. The committee is concerned that the department continues to pursue and fund activities that fall outside its mandate. So again, this particular target, which is around social support and empowerment, many of those activities were activities related to the WASH programs and the sanitary dignity, but it actually falls in the mandate of the Department of Basic Education and Health. So they spent money on doing those activities. The target was achieved, but the question is, should they have even done the activities in the first place? In terms of the sanitary dignity program, there are several matters of concern. There's no specific target. The lack of a specific target focused on monitoring and evaluating the sanitary dignity program by the department is noted with concern by the committee and must be addressed. The department identified the target number of progress reports produced per year on the implementation of the Sanitary Dignity Framework, which was in Program 2 as a priority focus in the 2023 ENE. So at the start of the ENE, they identified that target for the Sanitary Dignity Program as a priority area. But then this target was removed in its revised APP, citing that the provinces were expected to take on more responsibility in this regard. However, the department's key area of responsibility is monitoring and evaluation as a cornerstone of its mandate, thus not assessing the Sanitary Dignity Program as concerning. Just looking at beneficiaries, the committee queried how many girls benefited from the Sanitary Dignity Program per province against the target met for the 2023-24 financial year. In addition, the committee inquired about how much was spent versus that which was allocated per province for the program for 2023-24. The committee noted with concern the challenges with the implementation of the STP within provinces, and that within various constituencies, girls who were eligible did not benefit, nor were certain schools ever allocated. Hence, the committee queried whether the department had a list of learners who are receiving sanitary products in the country. The committee remains concerned. The committee remains concerned about the department's ability to effectively monitor and evaluate the STP. Furthermore, the committee acknowledges the responses to outstanding questions in relation to the annual report briefing, but notes that the information
Recording stopped.
is limited. So whilst information is provided on the reasons for budgets not used within each province, there's no corresponding financial details for the committee to assess what actually was allocated, if there were adjustments made to the initial budget for the amount of pads to be, for the implementation of the SDP, if there were adjustments made, and the actual expenditure as at 31 March 2024. So a narrative is provided from the department in that extra response with no expenditure incurred for the year under review. So we don't actually know per province what was spent. All the narrative says is where what the overall impression is of the expenditure per province. In addition, the committee acknowledges the number of beneficiaries per province, but it's unclear whether this was a target or just the actual number of beneficiaries reached by the end of the financial year. So if it was the latter, the committee is unable to assess whether the number of beneficiaries reflected is actually what was intended at the start of the financial year that each province set. In essence, the additional information provided by the department to the committee around the Sanitary Dignity Program. They give you all the 9 provinces, the reasons why money was spent or not spent, but they don't actually give you the actual figures. In terms of the beneficiaries, they just give you a number of beneficiaries, but they don't say if we wanted to have 50,000 in the Eastern Cape, we only reached 30. They only give you the end number. So you can't assess or evaluate what that end number is all about. In terms of distribution, the committee noted with concern the incoherent way sanitary products were issued within provinces, and the departments responsible for the distribution of the sanitary products differed between provinces. In turn, this brought into question the effectiveness of the Sanitary Dignity Framework implementation. This was confirmed by the department's written response to unanswered questions to the annual report briefing, and it stated that 4 provinces implemented the Sanitary Dignity Program via the Department of Social Development, and then 4 to the Department of Basic Education. I'll just check, I think it was 5 through the Department of Social Development and 4 through the Departments of Basic Education. But I will verify that in terms of the responses. With regards to SABS compliance, the committee notes that the department maintained that it has been successful in ensuring that there's collaboration between the South African Bureau of Standards to secure more menstrual products with SABS certification beyond disposables and reusables. However, the committee's oversight visit to the Mpumalanga province during the 6th Parliament revealed a different reality on the ground. The committee's engagement with that province's Department of Social Development reported that there were several issues of concern, which being deviation of the contract, being delivery, sanitary towels that are not SANS, therefore compromising the health of the beneficiaries. Some learners have developed a rash as a result. In turn, the Provincial Department of Social Development had at the time outlined several commitments to raise, which included the recall of non-compliant sanitary towels that are kept in schools, noting the risk of possible usage and the challenges that may arise as a result, and government being responsible for violating and not protecting the right of the poor. So what this shows is the committee's oversight, the reality on the ground. We face that girls had received in Mpumalanga province products that were not SABS compliant, yet in the annual report, the department is giving assurance that there is SABS compliance. Moving then on to the Provincial Sanitary Dignity Committee. The status of the committee is an area of concern for the committee, given the numerous challenges identified by members in various provinces, which should have been identified and addressed by those structures. It puts to question how functional these structures are, and if they even exist. Furthermore, what the committee's oversight visits during the 6th Parliament revealed that the existence of these committees, despite the existence of these committees, the framework was not implemented effectively, and very little to no attention was put on sanitation, washing facilities and disposal. Chairperson, sorry, if you mind, if Nelisa can just read the next section for me. I just need to get some water, if that's okay. My voice is a bit parched. Is that fine? If she can just read the section on rapid response, please.
No, that's fine.
Thank you.
Melissa. Where is Nelisa now?
I'm here,
No.
Chair. I'm here, Chair.
Uti, she's requesting you to read from E, because she has gone to get some water from Rapid Response Team.
Oh, thank you, Chair. On the rapid response, the committee commends the department for achieving the targets related to capacity building of the RRTs. However, the committee remains optimistically cautious about the department pursuing activities with its limited budget and capacity constraints that fall outside the mandate. Moreover, the committee's oversight visits during the 6th Parliament revealed many challenges with the establishment and funding of the RRTs, given that in some instances, NGOs were supporting and funding these with very little or no support from the government. This brings to questions the sustainability of such an initiative in the medium to long term.
Thank you, Nelisa. Thank you, Chairperson and members. It's needed to get some water. So in essence, the key concern around the rapid response teams is that the oversight revealed that there's a problem around funding these teams, and we had visited several provinces. And so the concern from members in that oversight was, how are these teams going to be taken up and be funded in the long term if NGOs were being the brunt of having to fund them? So in terms of GBV donor funding, the committee notes the significant donor funding received from the EU and CADA for GBV-related activities, and sought more information on the status of the projects and the related funding implications. With respect to the monitoring and evaluation of the National Strategic Plan on GBVF, the committee commends the department for assessing several national and provincial government departments and municipalities. However, The committee remains concerned about the impact of the interventions as GBV continues unabated at an alarming rate. Moreover, the committee notes that a comprehensive M&E of all relevant departments and entities are required on a quarterly and annual basis to assess the full extent to which the NSP is given effect to. An assessment of only a few departments does not provide a comprehensive understanding. Same applies to the National GBVF Prevention Strategy. So for the year under review, they did do and reported on this to members. They did assess a few departments to see who's implementing the NSP. But I think the key issue is it can't just be a few departments that has to be assessed. All the relevant departments and entities responsible must be monitored on a quarterly and an annual basis, and there has to be a report in that regard. For Program 3, Gender Mainstreaming, the committee commends the department for the targets achieved by assessing several departments on the implementation of the gender-responsive planning, monitoring, evaluation, and auditing framework. However, the committee was concerned that the department has not ensured the effective implementation of its frameworks and policies within government and cited the Department of Public Works as a best practice example for developing a sector-specific gender mainstreaming policy as identified by the AG. To this end, the committee indicated that compared to other departments, DPWI had made progress in developing relevant policy to foster gender mainstreaming. The department notes that it is working in collaboration with National Treasury as a lead on gender-responsive budgeting. To date, a GRB guideline has been developed and is currently being rolled out to departments. This has been an ongoing initiative since the inception of the department and even preceding the department in its current form. So the issue of gender-responsive budgeting, it's not new. It probably dates back at least 15 years. I think Ms. van der Merwe would recall in the initial parts of engagement with the department that had spoken to matters related to GRB.
Recording in progress.
The committee commends the department for producing several research reports and undertaking monitoring and evaluation, but remain concerned about the over-reliance on consultants to do this, with no evidence to indicate the existing staff were capacitated to acquire the requisite skills through working with the consultants. So the issue here is the committee acknowledges if you have a consultant because your existing staff don't have the skills, then the existing staff should work alongside with the consultant to be able to gain those skills, so that in future you don't have more consultants, but it forms part of a capacity building initiative. In terms of the integrated knowledge hub, the committee notes with concern that the target has not been met despite activities undertaking and that it's a long-standing matter. For stakeholder engagement, the committee queried whether the 278 million for meeting held virtually was the cost for data, given that a similar meeting with more participants incurred no costs. The committee was concerned about the determination of costs for conducting similar activities. The committee questioned what the impact of the minister's international trips were, given the costs incurred and how this contributed to the work of the mandate of the department in achieving the objectives as outlined in the APP. Now looking at Program 4, which has two components, the disability and the youth. Disability first. The committee commends the department for the improvement of performance in terms of targets achieved. The committee inquired about the working relationship between the department and the Council for Persons with Disabilities. To this end, the committee reiterated the importance of coordinated and meaningful stakeholder engagement within the disability sector. For the Disability Rights Bill, the committee requested more information on the Disability Rights Bill and reiterated the importance of the development of legislation in this regard. The committee observed that the South African Law Reform Commission has issued a discussion paper which includes a draft bill which is out for public comment. Whilst the committee acknowledges progress in this regard, the committee is not satisfied with the slow pace of progress and what the department is doing to expedite the process, as the department would be tasked with tabling of this bill, i.e. the department then becomes the sponsor of a disability rights bill. For sign language, the committee asked what the department has done to ensure that sign language services are offered in all government departments to assist people with disabilities to access government services. In terms of the 2% target, the committee notes with concern the slow pace of progress within government to implement the 2% target, and that the revised targets have been increased in order to give effect to the white paper on the rights of persons with disabilities. However, the committee maintains that without enforcement and consequent management for non-compliance, the status quo would remain. For youth, the committee noted with concern the department focused on agricultural and bakery initiatives within the program when the department was not a service delivery entity. The committee was concerned that the pursuit of such activities deviated the department from fulfilling its required mandate. Moreover, given the limited budget, the committee saw clarity about the costs related to these initiatives and the impact on the program. The committee agreed with National Treasury and the refusal to fund agricultural, which was the farming and the bakery initiatives, as these reside with other lead departments who have earmarked funds to help farms and small businesses. To this end, the committee was concerned that the department still intended pursuing these initiatives in the 2024-25 financial year, and that it should desist from doing so. The committee maintained there was not an optimal use of the limited budget, and the activities did not fall within the ambit of the department's mandate. Furthermore, the committee asked what mechanisms have been implemented to ensure that money used by the NYDA has meaningful impact on youth in the country, and what the role of the department was in this regard. The next section will look at observations for the CGE and then the NYDA. So general observations for the CGE, the committee welcomed the tabling of the annual report within the required time frame. It was concerned with targets which are not met by the CGE, but commended the CGE for improvement in performance from 2022-23. The committee noted with concern that 2 targets in the strategic outcome 4 reported as achieved actually at the value changed from what was set in the APP, and as such these targets were then not met, but neither the ARC or the AG had commented in this regard. So in the initial APP, the achievement for one particular target in the SO4 was 100%, but in the annual report, they're saying the target for the year was 80% that they achieved it. So yes, they achieved the 80%, but when we compare it to the initial APP, we can see because the values changed, they then didn't actually achieve the target, but the AG didn't pick it up, nor the ARC. The committee questioned how the CGE holds institutions accountable on gender mainstreaming, as implementation in this regard was poor, which was concerning for the committee. The committee queried how the CGE empowered men to deal with gender inequality, mainstreaming, and GBV, as this was not forthcoming in the report of activities for the 2023-24 financial year. The committee was concerned that despite targets met, the implementation and impact of those targets in communities was not apparent. With respect to the performance of commissioners, the committee noted with concern that the role of the commissioners appeared to have been diminished and limited to leadership over the administration in the CGE and fiduciary duties. Given the CGE's limited budget, the committee maintained that commissioners have a very important role to play in giving effect to the mandate of the CGE and contribute directly to the achievement of targets as outlined in the annual performance plan. As such, the committee reiterated the importance of commissioners reporting on how they give effect to the mandate on a quarterly and annual basis, as this would in turn provide greater insight for members into the work done in provinces. For human resource matters, the committee noted with concern that the target related to the vacancy rate was not achieved, and that it was because of filling of vacancies were delayed pending the finalization of the business model. However, the committee questions what actions were taken by the Human Resources and Remuneration Committee during the period under review. Now, this particular committee is managed and dealt with by a core group of commissioners. So that's part of their fiduciary duties. So the question here is, they didn't meet the targets, vacancies were not filled. So what was this committee doing during the year to meet and to hear what the challenges are and what needs to be done to address the vacancies? The committee observed that in the CGE's 23-24 annual performance plan and budget presentation in May 2023, the Commission provided the committee with a breakdown of projected allocations and expenditure per strategic outcome. However, this level of detail has not been provided in the annual report or in the finance presentation forwarded by the Commission. The lack of detail in this regard impedes the committee's oversight. The committee notes the CGE incurred over expenditure, which was just over 2 million for the year under review, but that it underspent on employee costs by 4 million. In terms of irregular expenditure and fruitless and wasteful, the committee noted with concern the irregular and fruitless and wasteful expenditure incurred for the year under review and the reasons provided in that regard. In terms of payment of commissioners for payment of the part-time commissioners, the committee noted with serious concern the matter has still not been resolved. So this issue has been for the past 2 financial years, which at the end of the briefing by me, Crystal then just talked to members a little bit more and give context to what that issue was. For strategic outcome 1, court monitoring, the committee commends the CGE for the number of courts monitored and encouraged the CGE to continue work in this regard. For police stations, SAPs and TCCs, the Tutuzuela Care Centres, the committee commends the CGE for the number of police stations and TCCs visits. The committee commends the CGE for achieving the target in terms of case management, but notes that it's merely process related and provides no insight into the number of cases per province, the nature of cases opened, closed and pending, all of which is crucial. The annual report limits reporting in this regard on complaints handling to bar graphs and a limited narrative explanation. The committee observed that even though more files were opened in 2023, less files were closed, but no reasons provided in the annual report 2020-2023. It's unclear how many cases were pending by the end of 2023-24, as this was not stated in the annual report, nor was it stated in the previous financial year, 2022-23. Furthermore, disaggregation by province for files closed were only noted in a bar graph, but the exact case numbers not provided. In addition, the disaggregation of type of cases was also not provided, which was normally done in previous years. So in terms of cases, this means what the CGE, one of its core duties is across the country at the offices. If you have an issue gender related, you can go to the CGE office and open up a case. And in years gone by, CGE in the annual report would give us details of, in the Eastern Cape, we received 60 cases and 30 of them related to divorce and 10 to GBV. But in this annual report, we don't have that detail. This matter was raised with the CG at its last annual report briefing in 2023, but the information has not been forthcoming, which is concerning. The committee observed that based on the statistics provided in terms of cases opened, the numbers are extremely low, which is concerning, as it showed that on average, provinces would have opened only 1 to 3 cases a month, which is unacceptable in a country where gender inequality, discrimination, and GBV is still rampant. Whilst the number of cases closed may have increased from the previous financial year, the committee observed that when examining the province with the highest number of cases closed per month, it was only 3, which is still very low. This is an area of concern as the issue of pending cases, which is not disclosed in the annual report, will further compound matters. So in essence, the issue of complaints coming to the department from the public, which are cases, we don't have a lot of detail about the cases, but where they give us the numbers per province, when you drill down per month, there are very few cases that's being opened. So for an entire month, one province would have only opened 1 case, and in another province, there may have just been 3. For the review of the CGE Act, the committee notes that the review of the CGE Act and urges the Commission to share the report in this regard. For the second strategic outcome, The committee commends the CGE for the gender mainstreaming session conducted, training undertaken, public education outreach, including radio session and stakeholder engagement during the year under review. So they've done quite a bit. However, the committee remains concerned about the impact of these initiatives on the lived experiences of women, youth, and persons with disabilities in the country, particularly in rural areas. So yes, we acknowledge they've done quite a bit, but what's been the impact? For the third strategic objective, the committee commends the CGE for reports developed, but remains concerned about the implementation of recommendations emanating from these reports. And for the strategic outcome 4, which is focused around the CGE's administration, the committee notes with concern that strategic outcome 4 had the most unmet targets as challenges with internal operations and processes may have a negative impact on service delivery. In 2022-23, this outcome was also the poorest performing outcome, highlighting that there is a need for stringent monitoring in this regard. So what this essentially says is there's a problem here with this program or strategic outcome 4. It's consistently not meeting targets, and the monitoring in this regard needs to improve. Visibility. The committee notes with concern the lack of visibility of the CGE within provinces, particularly in rural areas. For the Legal Practice Council, the committee noted the progress update on the CGE's legal standing and reiterated the important role the CGE played in terms of its legal mandate. For the use of consultants,
Sorry,
the committee yes.
sorry, Ms. Abrams. Sorry.
Yes.
I see that this presentation is a bit long, and I don't know, because members are to take the 12:30 bus. The sitting today is physical. If you can just touch on the key issues, remember that
No problem.
we are still going to come back.
Okay, sure. No problem, Chair. I'll just highlight. So for the consultants and the CGE, we're spending money on research reports. Even though they're saying they're spending only 2 million because of resource constraints, but the actual amount spent was 5 million. So they're spending a lot of money to do the report, but outsourcing it. The AG's comments for the CGE, it was around that fictitious supplier, the 7 million in terms of unauthorized, irregular and wasteful expenditure wasn't investigated. There was a concern there. In terms of consequence management, the issue was there's lack of consequence management. For the CGE's ARC, the ARC basically congratulated the CG for the opinion, applauds management for creating human resource capacity. It notes matters pertaining to the internal control as well as performance management and risk management. For the NYDA, yes, they achieved 100%, but there was that qualified audit finding. The key issue here, in essence, is they've reached 100% of their targets, but are they making an impact? Are they reaching youth in rural areas? Cost-benefit analysis, members raised, you're going on international trips, but how feasible is it? Or how many people are you actually able to take? Shouldn't we be focusing more local? The concern again, reiterating youth unemployment, it's a major concern. Is the NYDA making an impact? Are you reaching youth in rural areas as well as youth with disabilities? For the AG, you acknowledge the committee in terms of the audit outcomes, and after 9 years, it's a qualified audit. The key concern was around the balance sheet, that aging list, the clearing accounts, and the employee costs, as well as the risk analysis. They responded to all of those matters in a brief that was sent to members, I think on Thursday, if I remember correctly. That's why I sent it. So they did respond to what those concerns that members were and for additional information. Again, for the ARC, for the AG, they concurred with what the NYDA had to say. For program 1, we've highlighted again the key issue there was around that audit finding and in relation to the disability employment equity targets. For the performance of the board, they commended, but again, members question in terms of the choice of activities, is it making an impact and how are they being assessed? Program-specific matters, are they collaborating with others? It should be encouraged empowerment of girls versus boys. Again, the committee is saying, we're not saying it's not important, but questioning what's the impact of these activities in terms of communication. Is it really impactful? Are you reaching youth? And again, the concern, there's no real strong emphasis on boy, child, and young males. In terms of recommendations, what we have is an outline of general recommendations to the department, what the committee requests, specifically for the audit action plan that the department needs to develop and submit to the committee so that we can track what progress they have done in that regard. For financial performance, we specifically identify recommendations for the in-year monitoring reports, keeping a tap on their spending trends, what you require of them for the APP, to be kept abreast of irregular and fruitless and wasteful expenditure. The issue of the deviations and the discrepancies with the OCPL must be addressed. Donor funds, we're requesting a much more comprehensive report so that we have insight into who's the money coming from, for what, and what's it being spent on. ARC should continue monitoring them. Resources, funded vacancies that should be filled, which should be kept abreast by quarter if there are any changes. Use of consultants, desist. Disciplinary cases, the department should submit a comprehensive report on all cases. Governance, they must comply, again, with investigations, keep the committee abreast of matters. For performance related, the APP must be must ensure the SMART principle, that in other words, their targets outline must be SMART. For the gender machinery and the disability machineries, these are important initiatives, but share with the committee when it happens and what the outcomes are. For treaty compliance, indicate to the committee what a report is due in a financial year and report back what feedback you receive and present the report before you take it to an international audience. Reports, submit the outstanding reports. In terms of policy and law reform, submit all outstanding. For GBV, provide quarterly updates to give us an indication in terms of your monitoring and evaluation, who's doing what in terms of implementation, where are the problems. Sanitary dignity, this needs an overall. We need a comprehensive understanding and assessment which the department must do and present to the committee. For rights of persons with disability, report on reports, as well as expedite the process around the Disability Rights Bill. For youth, all the reports should be submitted, and again, expedite the process of the South African Youth Development Bill. For the CGE, in terms of the finance, we also want that audit action plan to be submitted so that we can track how they're implementing the recommendations. They should resolve audit outcomes, manage the issues of irregular expenditure and fruitless and wasteful, report to us about the surplus funds. There should be monthly reports on any key issues of concern, desist from using consultants, but provide us with information for where they are. Investigations, keep the committee updated. The issue of the part-time commissioners, they should engage with the AG and the ARC, resolve the matter, and report back to the committee. For the governance, the business model, send it to the committee so that you engage. For the Legal Practice Council, keep the committee updated. For program performance, fill vacancies, improve complaints handling, continue your work around SATs and TCCs, ensure sign language to communicate with the community, and then the suggestion of having gender mainstreaming be placed in the Office of Speakers in municipalities. For commissioners, get a comprehensive report on provincial deployment, how they intend delivering on strategic outcomes, per program, and they must report back to the committee on a quarterly and annual basis. Vacancies, fill vacancies and report back on a quarterly basis. For the NYDA, again, as with the other two, request for the audit action plan by 30th of November, report on progress at every quarter. Where targets are consistently overachieved, they should reevaluate and maybe set the target higher, collaborate with other stakeholders to ensure that their reach is extended, fill the vacancies, and engage with Treasury on extending the PYEI into the 7th administration. For National Treasury, request to consider the condonation request by the department and the CGE, as well as the rollover funds by the department and CGE, as well as the PYEI for the 7th administration. And for National Treasury, just to reassess the funding allocation to the department, CG and NYDA to optimally implement the respective mandates. For the AG, to monitor and evaluate the mitigation strategies and tracking resolutions, to resolve this matter with the CGE about the payment of part-time commissioners, to keep the committee up to date about the re-audit of that NYDA, given their audit finding, and to consider the audit of donor funds for the department, CG and NYDA. Table 13, it's just a synopsis of what we require in terms of reporting matter, the action required, and the time frame. So, for example, just to give you, for quarterly reports, we want that in a written format plus a briefing. It should be done every quarter, the department, the CGE, and the NYDA. So we've just captured in a table what those key issues are that we require for the all three to either do per quarter or with a specific time frame. So chairperson, members, thank you very much. I know the report's been very long, but we've tried really to be very comprehensive as possible. With chairperson's permission, if Crystal and Tasneem could just give 5 minutes of what those key issues are for the CGE and the NYDA. Thank you.
Thank you very much. I was going to speak on that, just trying to check if they will then be able to just stick on 5 minutes is a bit long. Remember that members are to rush for passes. If you can just stick on just elevate key issues so that I do have by at least members must be done. The latest will be 12:15 or 12:10, just to allow members to reflect on some of the issues. 3 minutes each, please, if you can manage. Your report was a bit long and comprehensive, so it took too much of the time, but it's fine. Tasmin, can you come in?
Yes, Chair. I'll be super brief because Kashfa did touch on some of the matters. But I think just in terms of the NYDA, for members to be mindful that they have the largest budget combined compared to the CGE and the department itself. So just going forward, issues related to the budget specifically, that, well, from our perspective, they have a greater accountability because of the large amount of money they have. So going forward, I think members need to request, or the committee needs to request a programmatic breakdown. At the moment, it's not that the NYDA is being untoward with their finances, but we need more transparency in terms of their program breakdowns. So at the moment, they provide an overall picture in terms of this is how much they spend. But it would make more sense, especially since after 9 years, they've received an unqualified audit. So the members need to scrutinize their finances more closely, as opposed to it's been done in the past few years. So just in terms of information that's being provided, in terms of our analysis, Crystal, myself, and Kashfa are limited to what's provided by the department and the entities and the National Treasury. So we are at the mercy of what the entity provides. So going forward, we're going to have to scrutinize the finances much more closely. That includes the donor funding and looking at the financial expenditure in general. Thank you, Chair. I tried to be as brief as possible.
Thank you. Is there somebody else who's to come in?
Yes, Chair, it's Crystal.
Crystal, yes.
Yes, Chair. So I'm also going to be very, very brief. As Kashiva indicated that the CGE, one of the matters that they had arising was around the issue of the 100 hours matter that wasn't finalized with the Auditor General. So just to give members some context, during the time of COVID, one of the things that happened was that because of the lockdown, initially the CGE was not allowed to obviously go out and perform the duties as they usually would. And during that time, so there was a bit of how should I say, some of the commissioners felt it was unfair because there's a difference between how full-time and part-time commissioners get paid. So full-time commissioners get paid on an annual, on a monthly basis, with a fixed kind of income, where part-time commissioners would have to submit timesheets, basically providing evidence for the hours that they've worked. So the part-time commissioners at that time had felt, well, it's kind of unfair because now they're not allowed to work given the lockdown situation, and so they won't be able to produce timesheets, and so they won't get paid, whereas full-time commissioners would. A decision was then taken by the plenary of the CGE to pay everyone a 100-hour flat rate. The problem was that during that time, there was no timesheets that were actually submitted to verify that the 100 hours were indeed worked. And so also, I think one of the other challenges was that in the CGE's handbook, it says that part-time commissioners may work a maximum of 100 hours. So it's not prescriptive that they must work 100 hours. It's that they may work up to 100 hours. Essentially, as I said, there was no paperwork to support the payment of that monies. That then resulted in them getting irregular expenditure during 2019, 2020. Also, the committee had been raised on numerous occasions and said that they need to stop with that kind of practice, and that they need to get the timesheets back. What happened was, from fruitless and wasteful expenditure, management then obtained the legal opinion, the management of the CGE, and they then changed it to from irregular to fruitless and wasteful. So up until today, that issue has not been resolved. It continued across multiple financial years. Initially, it was only going to be for a set period from April to October 2020, but actually that continued for a period of 22 months. Commissioners were being paid like that without any submitted. So that is the key issue there, Chair, that the matter still remains resolved and on their books.
Okay. No, thank you very much. Thank you very much. Members, those are the observations, recommendations, and some additions on key issues, which is quite a comprehensive report. And I don't know whether you have got some issues, because you must also be mindful of the fact that you are to rush for transport. I don't know whether you are going to manage to be as brief as possible. Safe to say, on my side is only one. I've got some challenges with 15.4, 15.74, and 15.75. Challenges in terms of, not unless my mind was somewhere in the committee. I'm not quite sure whether we did reflect on this when they were in front of us. I'm raising that because I don't want them to say, when they look into our report in terms of recommendations, they say we are unfair because we didn't allow them an opportunity to respond on that. The second one is the type of cases versus case numbers. Whether that is in the legacy report, I don't know, but I think you must note that. And the issue of the handbook of the CGE, I don't think we are, maybe in this term, we are exposed, we have been exposed to the handbook of the CGE. Members, there is the report. I know that in the presentation, the first presentation of the department, a number of members were not present. And I'm sure they will, maybe those that were present in terms of the presentation, the first presentation of which was done by the department. I'm raising that so that they don't stress themselves that much. We'll still have another term, another time to reflect. I am at your, should I say, at your mercy. What is it that you want to do? It's a very comprehensive. I don't know when last did I receive such a comprehensive BRRR report since I was a member in this parliament. It's quite comprehensive, though. I'm not saying it's wrong. It's only that we received it at a very short time. It's going to need us to, again, as I've said initially, to have another meeting. But do members have some clarities, short and sweet? Or do they think that their clarities are going to be a bit long and they are messed up in terms of attendance to today's plenary, which is physical? Hence, I see Honorable Spies, Honorable Van der Merwe. Those are the only two hands. Honorable Spies, over to you.
Thank you, Chairperson. Now, I first of all, I really do not have a question. I have a comment, and that will be very short and sweet. First of all, thank you very much to our support staff. I think I agree with you. It is a very, very comprehensive report. It is really quality work that is being presented. In that spirit, Chair, I would like us to, going forward, ensure that we allow the time set aside. I know things have been hectic for us in terms of time, but that we allow our support staff that hour before we get presenters to present, their input, because that would help us a lot and not make a report like this so long. Because I remember once or twice we couldn't accommodate them because we were running out of time and we had to go straight into presentations. But over and all, Chair, I concur with you. It is a fantastic, comprehensive report. It really allows us to clearly, engage with it. And obviously, as you clearly set out, that we will now obviously just round it off and give our inputs and then consider the report. So thank you very much, Chair. I am covered.
Thank you, Honorable Spies. Honorable Merwe.
Thank you very much, Chair. I will also just be very brief. Mine was also just to thank the committee staff for the great work they did in terms of preparing this report. I want to echo your sentiments that I think, coming from other committees, we are really proud of the work that this team has done in terms of this report. I just want to say that when we reflect in terms of but I can, just to save time, I can just put it in writing as well. But I think the issue of the fact that they did not provide us with more information on the 2 audit findings and that they wrote back to us without providing that information, it's really, it's very concerning. And that, actually then the question becomes, what is it that they're hiding? So I think when we make the recommendations, when we say they must submit the audit action plan, we must make reference to them giving us that information on the outstanding audit findings. So I think there must be an emphasis on that. I'm also glad that we putting a strong focus on the overall of the sanitary dignity program, because in fact, I've done some more research in terms of the the program here in KwaZulu-Natal, and there's a lot of gaps. But I think we will talk to that in our next meetings. But just to say that we thank them for the report, and we will go through it and provide more inputs if we do have them. Thank you, Chair.
Thank you, honorable members. Those were the two hands. I think we will, I will then be charged with a responsibility that I will have to lobby for the, I think well, maybe in terms of the deadline, because a comprehensive report like this, it really mean that we will have to apply our mind and be able to prepare as members of the committee, but again, obviously, as from our different political parties, if then we are afforded, depends if we will then be afforded an opportunity either to make declarations or the House will adopt our vote. It depends, you will know. But it then means we will then have to prepare. And for it then means in the next meeting, please, I'm pleading, please, we will have to be present. We'll have to make a quorum because we will then have to adopt the report. Because if we don't adopt this report, it then means our vote won't be tabled in Parliament. And I don't think that's what we want. So I also want to give benefit for those that were not in the first presentation by the department to also internalize with this report, and then be able to just ask and make those few amendments in the next meeting, but we'll then adopt our report with the amendments that we then have to prepare. So I'm pleading with ourselves that let's go through these recommendations. These are our recommendations, and they are in line with the questions that we have asked. And then I will then interact with the staff in terms of some of the areas that I've reflected on. And then in the next meeting, there will then clarities, amendments, and whatever, and we adopt that. But thank you very much, Ms. Abrams and your team, for such a comprehensive report, which really gives us a more insight and in line. In fact, it's in line with our questions, but you have broadened the content of our questions for people who will then be reading this report to understand. Remember that this is also for public consumption. That's what you must always understand, that when we ask questions and we get reports, these will be in the what are those books termed that people will go and read, and it's for public consumption. Before I forget, because of time, I was notified by the committee section that the advert for NYDA is in the website of Parliament for now, which is for the start. So members must go there. The others are then coming next week. But within this, remember that some of these processes are not in our control. I just want members to understand that, so that you don't frustrate yourselves and you also frustrate the office of the chair. It's in the website, and Nelisa and which ads in the parliamentary website, and which one? But the newspapers, it will be next week, but it's still within the same time period. So I wanted you to be alert, go to that website so that you are then able to sensitize your constituents areas. Immediately you see that. Having said that, I will try, I'm sure by the end of tomorrow, we'll know which day we are still going to meet. Thank you very much, honorable members, for your attendance and participation. I don't know whether if there are any other comments that would like to make. I don't see any other hands. Thank you. We will see, we'll talk again this week. We'll be attending again this week. Thank you very much. Are you still with me or you have left for buses?
Well, thank you, Chair.
Thank
Oh,
you,
okay.
Chair.
Thank you, thank you, thank you.
Thank you all.
Thank you.
Bye.
Long live the chair.
Thank you.
Thank you.